sit back, relax, and get ready because this is Things Mom Never Said, Secrets to Aging Well. Welcome back to another episode of Things Mom Never Said, Secrets to Aging Well. I am April Rocky, and this is my mother,
Sherry.
And we do this podcast because, quite frankly, women don't talk a lot about, or haven't in the past, about health or anything really, dealing with us and the world and how we're perceived and yada, yada, yada.
Right. All the above.
We bitch a lot, but we don't get into the details. So this is a podcast where we talk about things that my mom never told me and things that her mom never told her, and what we now know and what we as women are experiencing in today. So welcome if you are a first-time listener, and I guess watcher, because now we have video. But this is season 4, and we have been doing this for quite a bit. And so this year we're doing conversations about transformation and things that will help us have a better life or create a better life or pivot our life, whatever that means.
Okay.
Would you agree?
Yes, I would.
Okay. All right. Well, we've had some interesting topics so far.
Yes, we have.
And we will have more guests on. I think next time we're going to have a guest. So, but this one, again, is just going to be the two of us. The trash truck is going to go through here.
I heard it. That's all right. Makes me think of my childhood.
Never a dull moment here.
That's right. Mine was always the trash truck and the Iceman, believe it or not.
Okay, the Iceman.
Yeah, and a little man that would come in the summertime, not even once a week, but he would call out, "Strawberries, get your red ripe strawberries." And the women would come out and get their little strawberries, and it
interesting.
Worked. Yeah,
it's like the beer man at the ballpark. Beer here.
Well, now there's a new job for you. You can start that in the neighborhood and around Naples.
Yeah, that'd really fly here.
You might be surprised.
I'd have to give a happy hour discount all day to get these cronies out of their house.
Especially in the heat.
Right? Oh, yeah. All right. So as the trash truck goes away, so this topic is something I think we've touched on before in a prior episode, but I don't know that we really explored what is happening today. I wanted to talk about dental health. And I know that you and I have talked about a lot of the trappings of dentistry these days. And I did a little research, and because I was like, why now? Because I've always had pretty good teeth. And never an issue. And now when I go to the dentist, it's all of these things. And, my brain works in a way of like, should I believe this? Should I not believe this? What is happening here? Because I question everything. But here's an interesting fact. Did you know that menopause can significantly impact dental health?
Yes, I did.
You did?
Yes, well, you gotta realize I'm 77. I've lived through that, and women used to sit around and talk about such things. We didn't realize if it was true or not, but gee, ever since I turned whatever, I've had issues with my teeth or whatever.
People, so, yes. Things mom never said, right there. Things mom never said.
Never said it.
Oh my God. Okay.
Yes, so enlighten me. Tell me what you found out.
So it is a symptom of menopause to have dental issues, which no one has talked about, obviously, until today. Thank you. But even the dentists have just been like, "What? You just have a problem." So here's what we know: estrogen levels drop and women will frequently, as a result, experience dry mouth, which can lead to cavities. They will have inflamed or bleeding gums, receding gum lines, jawbone density loss. So you're going to lose bone in your jaw potentially. And that causes your teeth to shift around. So all of these, menopausal women, peri or post, are getting Invisalign because their stuff looks janky now. There's a reason for it. You need a bone density test. So I just was like, what? Because I recently had all of that stuff done on my one tiny tooth, which quite frankly, if it had been a back molar, I'd have yanked it and left it.
Yeah.
But, yeah, so it's really, what's crazy to me is that no one talks about it. And here we are with all these things, and your dentist is like, oh, you got dry mouth, oh, you got this, or you got that. But they're not talking about why. And then my brain goes to a place of, well, if you're getting estrogen supplementation through HRT or another way with your dentist or with your doctor, wouldn't that right the ship? Because your estrogen levels would go up a little bit more. So do you dive into all of the things dentally, or do you go fix your estrogen?
Mm.
You know what
Good
I mean?
point. Yes, I sure do know what you mean.
Yeah.
What
It's a little nutty.
What I want to start by saying is, what a shame that we have to question everything, that we live like we do in getting advice, even from a professional, and questioning it. But we do need to do that. There's all kinds of people out there, and when people want to make money, sometimes they are quiet about things, or don't delve into it, or take advantage of the situation. I hate that.
Oh my gosh, it's so crazy. And it's like, because nobody talks about all this stuff, like your doctor doesn't say, okay, let me give you the list of all of the hundreds of symptoms that you could possibly have in menopause. Nobody even, you don't even enter into that conversation. So you wouldn't even know. But then you get to the dentist and they're like, cha-ching, 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 cha-ching.
I'm telling you, medical and dental profession, those professions have changed. And I recently substantiated the idea that you only get 20 minutes with the doctor when you go to visit. Now, after my physical checkup a couple weeks ago, they announced to me that I cannot bring in other issues. Like if I also say, well, while I'm here, would you check my hip bone? It's been hurting, because they will charge you for that.
What?
That is through a Medicare program. That's the standard now. And I said, really? I always thought, hey, save up your ailments and your achy stuff, and when you're there, address it with them. But no, they don't want you to do that now. You have to make another appointment, or go ahead with that one quickly, but they charge you. And it was just like, hello, are you kidding me? So you're telling me that if I want the doctor to look at my big toe, they're going to charge me for that because I saved up and just waited until I came in instead of making various trips. And the idea is, yes, the bottom line, the truth is money, but the excuse is, if the doctor spends more than 20 minutes of his time with you, then that's valuable time, and other people have to sit back and wait on you. And I'm thinking,
rude.
Yeah. So that is a new claim now. And so when do you actually have a real visit with your doctor where you can go into those things? It's when you have an ache or pain and you call and go in, and they will just spend time on that. So I imagine the doctors are going to stop saying, and what else are you going through? And let's talk, what's going on? And because they don't know. They don't want to know because the insurance situation has changed so much that they're hardly making it. So they got to follow those rules. So here I am talking about the dentistry situation, and I'm not surprised no one says, well, let me tell you what's really going on, blah, 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 blah.
Mm-hmm. Yeah, there's so many things. To your point about paying additional fees, so I literally have been going through all of this implant, and then I go in the middle to get my teeth cleaned because we've been going through all this, and I'm like, okay, I need a teeth cleaning. She comes in, checks out around the, to make sure everything's okay with they had to put a little dummy one over it. And I get my bill, and they have charged me an extra $189 because she walked in the room. Oh. This is my dentist. Because the dentist came in where the hygienist was. I paid an extra $189. Are you kidding me?
That's when you say I drop her, and I let that out. I let people know.
She gone. Yeah. So then after finally get it all done, they call me. And the hygienist, oh my God, I just was so, she's going into all this stuff about, well, we're going to get a mouth test, and we got to fill you other issues, we're going to do this, and da, 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 da. And I'm like, what? Are you kidding me? And I know it's not her, but she's been trained to do this, right?
That's right.
Let's
get
Absolutely. You in for more shit because we got a live one here.
Yeah.
And I said, there's nothing wrong with my mouth. I just have gone through, I'm not joking you, over 2 years of surgeries and back and forths with the dentist on one tooth. Mm-hmm. 2.5 years. And she's asking me for more money. And I said, let me tell you this. How about if I'll call you, don't call me? She's like, well, okay, but, I'll let the dentist know. And I was like, yeah, you let her know. You let her know. Because there's no way in hell I'm coming back there. Mm-hmm. So, yeah, we're at a new dentist.
Yeah, good.
Mm-hmm. She doesn't charge me $189 to walk in the room when the gal's cleaning my teeth.
Yeah, right.
So, anyway, before we get into different dentists and all the things, let me finish the menopausal thing so that everybody's quite aware of what issues could arise so that you can be prepared. So we talked about the dry mouth. So and this is why this is an issue. Decrease in saliva reduces the natural ability to wash away bacteria. So it significantly increases the risk of cavities and oral infections and thrush. That's a biggie.
Yes.
Gum disease. The drop in estrogen makes the gums vulnerable to inflammation, bleeding, and receding, and can eventually lead, if not taken care of, to periodontitis, which is a cause of tooth loss. The jawbone loss. So we all know estrogen. They always talk about bone density testing. This is why we get it, because the estrogen can cause the jawbone to lose density, which means it gets smaller, the bone gets smaller. And that has the risk of teeth shifting, which could lead to tooth loss, dentures, and pain. Mm-hmm. And then another one, burning mouth syndrome. Have you ever heard of that? Burning mouth syndrome?
No.
So it's a persistent burning, tingling, or a metallic taste in your lips, tongue, or throughout your mouth. Who knew?
Right.
I'm like, what? And then it says, ensure that you are obviously dealing with your estrogen. It does not say that here. But it says drink plenty of water. If you must, use a fluoride toothpaste, floss daily. Now, I question the fluoride thing. That's a whole nother issue that we would need to talk about. Maintain regular checkups with your dentist, discuss your menopausal symptoms, be proactive, yada, yada, yada. So there we go, friends. That's your menopausal situation.
Mm-hmm.
So now let's get back to the dentists themselves, because I think that this is a thing, because now there are dentists of all different shapes and sizes out there. Used to be like, you go to the dentist, this is what the dentist does, that's what they all do, same guy, different day, right?
Mm-hmm. Mm-hmm.
But it's not anymore. Have you ever come up with another dentist outside of what you thought was a normal practice?
If I'm following what you're asking, yes.
Uh-huh.
And sometimes I thought, well, when I was younger, there were different toothpastes. Ipana, I think, was the one of them. And when we found Crest, and it was supposed to be the do-all, kill-all, we started using that. And for the most of my life, I've used Crest toothpaste. So my take on that was, well, gee, if that was such a great toothpaste, and it did all the things that they advertised that it would do, and back in those days, it was probably correct advertisement. Maybe what's happened is it has taken care of so many of our issues. Now the Association of Dentists has to start coming up with some new ideas, some new things in order to sell dentistry, because our teeth are better than they've ever been. So at that point, we have panoramic views of our head for our teeth, all kinds of different gimmicks for counting teeth and assigning a number to it, and all kinds of things that they're looking for. And that it may be good. Part of my feeling is not everyone is sincere and honest, and there is, I believe there are people in every field that are dishonest, and they take advantage of the situation. And I've got a couple of examples of that. And when you feel like you had to fight your dentist to get out of there, you realize something's very wrong. So you can be very fortunate to find a person of character and be able to go back to that person and them deal with you honestly. And so I think that's what we all need to continue to strive for, to find that type of person that you can trust. But otherwise, I think many people in many different occupations or in advertising trying to sell something are stretching the truth about a lot of things. So, yeah, I've been through all kinds of situations with my dentist, and I've had various ones because I leave them. If they're doing something that I think is very wrong, I make a determination. And if I have proof of that, I share it with people, because it's a shame that someone would go into a dentist and he would take advantage of you just because he wants to make more money.
Yes, and yes, all of the things, yes. So it, just like in everything else, I think that we were programmed to be like, you find a person and you stay with them.
True.
And you do the We also were never taught that this person works for you.
Mm-hmm. You paying that person, you should expect more.
Absolutely.
You can expect more.
Absolutely. And with that, you need to find someone to partner with that actually works with you, understands what you want, is there for the kind of care that you want to receive. There are all sorts of new tools and techniques that dentists are using now that are better than what they had before. mentioning like the whole head scan, that's brilliant. If you can just do one biggie like that and they can see how your jaw is aligned and how things are formed, that's amazing. That's great technology. The testing, the number testing that you said, that's for like gum recession, which is great because you don't want your gums to recede. Then that causes other periodontal issues. It also causes bacteria to get into places it doesn't need to be. Those tests are good for us. So when I asked the question originally, I was thinking about like schools of thought with dentistry. So there's like mainline dentistry. There's also now a biologic dentist, and there's also concierge dentistry. And biologic dentistry is someone who is a dentist who's been trained to look at the whole body as what could be causing things. So this is a person who should have said, check your estrogen levels, because you're having a lot of issues in your age range. You may want to see if your estrogen's off, because their whole thing is that they look at the holistic approach. They are taking your blood pressure every time you come in before they do procedures. They really should be more in tune with your body system and what you're eating, how you're exercising. Like they should be asking you all of those things so that they can get a really good picture of your overall health, then to treat your dental health. They also are really focused on not using toxic materials in their dental practice.
Awesome.
So when I went in and I had a silver filling, like actual silver in my mouth, they were like, that is secreting toxic material into your system, and we got to remove that. And they remove it with a full hazmat situation, because drilling into that silver, getting in and getting that out can cause airborne toxins, and they want to make sure that it's minimally invasive procedures so that they're not causing other health issues, because like a silver filling, if it gets into your bloodstream, that can cause a lot of other issues in your entire body. So they're super focused on that type of dental care. And I have been to a biologic dentist. I love the fact that they take that time with you, that they look and use other forms of materials when they're doing things. They offer you options. Instead of using cadaver bone, I was able to bone graft bone from my own body, and use PRP, which is a plasma-rich protein injection of my own plasma to help my gums grow back and my bone grow back faster, which it did. So they're looking at things from that angle more than what a traditional dentist is just going to go in and do what they've always done, right?
Makes sense.
Yeah. So that's kind of the gist of like a biologic dentist. Now, they are trained by the American Dental Association, but they take an extra training to look at dental practice more holistically and with different natural materials that will not be toxic to the body.
Okay.
So concierge dentists, which is now new. There's a lot of concierge medical, because they don't want to deal with insurance companies and be held to, like you said, the standard of Medicare of you can't tell me all your things. You have to come back for 15 appointments. They don't want to work with that. Mm-hmm. So these dentists operate outside of the insurance company, and you can pay for them and pay for their care with your health savings account.
That's wonderful. That's good.
So that's brilliant, because you're still using that insurance account to pay for it, but and your procedures can be submitted to insurance, but they won't do it for you. because they don't want to be beholden to how they practice in that manner. And they also have this model of like premium care. They will sit and take time with you. You have opportunities with them to come in multiple times. Sometimes they'll do it on the fly. You don't have to wait for a time, depending upon how they run their practice. They look at it as very convenient for you and very personalized. And that's what their kind of model is. They also look at whole health. Like, what is your diet like? What is, how often are you taking care of your teeth? What kind of products are you using? They'll dive into all of that with you too. So we currently have moved from a biologic dentist to a concierge. And I'm going to tell you, this practice is amazing. The doctor is incredible. Well, like super knowledgeable, has all the latest tools at her disposal, but is like, if this doesn't have to be done, we're not doing this. Is very conscious of what's the best for you. We're paying 3 times less what we paid with our last dentist, and we get more. Our x-rays are included, our full head x-rays are included, cancer screenings included, saliva tests are included, like all this, plus 2 cleanings a year, like all of this stuff for Travis and I.
Wow.
And she took the time. Her hygienist took the time and cleaned our teeth. I have not had a clean like that since I was a child. Like every little thing, they did the new stuff, they did the old stuff, they had the picks, they did everything, and my gums did not hurt.
Oh,
My mouth was not, like sore, like nothing. Yeah.
Wow.
Brilliant.
Well, it is the future, isn't it?
I think concierge medical is the future because people want that extra time, and people want to have a trusted advisor in their health. And if you can get someone who is knowledgeable, slow, really looking at everything, it's a godsend. It's like nothing. I haven't had this kind of care since I was a kid.
Yeah. I understand.
Yeah, it's wild. It's so wild. So, I think the misnomer with concierge is that it's going to be more expensive, but I don't think that that's always the case.
Interesting.
Yeah, for us, it was like, oh, that is incredible. Because we've been paying a premium at this other dentist, obviously.
Yeah, sounds like it.
My kitchen remodeled tooth.
Yeah.
And thought that was just how it was going to be for us to get good health care. Right. And when I literally stumbled upon this dentist because I was asking a friend if they loved their dentist, and she was like, oh my God, I totally love this dentist, and had told me that someone else was telling her she needed to have this dental work done, and she went into this dentist, and the doctor was like, you don't need that. That's not what we need to do right now. We need to try something else before we have this procedure. Like literally scheduled the surgery and was like, wait a minute, no, hold on.
That's wonderful.
Saved her tooth, saved her $900 for the whatever they were going to do, and her mouth is healthy.
Wonderful.
And so I was like, that's a great recommendation. Let me have her name and number.
Yes, that's right. That's right.
Yeah, and we went in, and I was like, oh my God, thank you.
Yes.
Yeah. So I think that we, couple things to take away with this is we really need to know what is a result or a symptom of menopause, so that we know that, hey, wait a minute, maybe we could do something on the estrogen level before we dive into extreme dental care, to see if it rights itself. So that's one. Two is finding a physician who will take the time and that you can trust to do your dental care. Mm-hmm. And that really takes some shopping around, but don't be scared of trying the alternatives to what we know as like normal dentistry.
Mm-hmm. Mm-hmm. That's true. And we do need to preface all this with, hey, that may just be a few professionals that act and react this way. I know there are a good many of reputable people, but I guess being aware of situations that do happen and realizing that you can speak up, those are two really important factors to all of this.
Yeah. And you should speak up because they work for you.
Mm-hmm. That's right.
And if it doesn't feel right, then it's probably not right.
Mm-hmm.
Like if someone says, oh, we need to do this and this, then and you get a bad gut feeling about it, then you should take a step back before you go forward.
Mm-hmm.
Yeah. One thing I will say, and I will leave you with this. I know that the recommendation for dental care was fluoride driven, but I also know that continued use of fluoride can cause cancers and other chronic illness. I don't know if you're on the fluoride team or not fluoride team. It doesn't really matter, but there is alternatives to fluoride toothpaste.
Mm-hmm.
So the alternative is the nano hydroxyapatite, which is a mineral based. It's a complete fluoride alternative. Does the same thing. It's better for your teeth. You can also ask your dentist for an option. They usually will have a recommendation. Some of those can become kind of expensive, so look for something that is within your price point. There's also xylitol is a good fluoride replacement that works on like bacteria and prevents it from sticking to your teeth. And there's also calcium and phosphate, which are minerals. So if you're drinking a lot of mineral water, spring water, there's always going to be a lot of calcium and phosphate in that water. You're going to get that naturally. And that just helps to have good gum health and good teeth health. Let's see what else. Oil pulling. Have you ever heard of oil pulling?
No.
It's where you take an oil like a coconut oil or a plant oil, usually coconut, and you swish it through your teeth. It's like
okay.
It's like with your teeth closed, but you're you're kind of swishing it through so it gets it in the gums and everything to clean it out and get that bacteria out. And they also recommend what's the other one? Green tea is really good for dental health too. So there are natural alternatives. Let me know if you try that oil pulling. I'm not there yet because I don't know. That's a lot. Yeah. It takes a lot.
Yeah.
Well, you gotta it's a technique and you gotta
Right. I'm not sure if you had mentioned the coconut oil to me or if I read that someplace, but that supposedly is very good for your gums and whitening of your teeth. And so I did get some coconut oil. I was able to find it at the supermarket. Mm-hmm. And I would put that on my teeth and gums and kind of rub them a little bit. Mm-hmm. And I had forgotten about that. So maybe, similar to the same idea, but not exact. But it was good.
Yeah. There are also, for gum health in particular, and one thing that I know actually helps gum grow more is peppermint oil.
Ah.
And we got a peppermint oil toothbrush or toothpaste
Okay.
for Travis because he has receding gums, like a hereditary issue with really receding gums. And we started him brushing with peppermint oil toothpaste. His gums are like better than they've ever been. They've
Really?
grown more. I mean, it's insane. It's insane.
Awesome.
You do want to talk and work with your dentist on finding the right product for that, but because you don't just want to get like essential oil peppermint and start putting it in your mouth because some of
Right.
that's toxic
Right.
on how they process it. But if you can find a toothpaste or a brand that's peppermint, it's brilliant. The other thing, we had a mouth rinse that we were introduced to during my surgeries that has a mixture of peppermint oil, arnica for inflammation and bruising, and there are other
Minerals.
oh my gosh, I'm losing. Yeah, I healed up so fast because I was also taking different like arnica internally and swishing with that rinse and doing other things. And there were a lot of homeopathics in that, but I healed up quick, like
Wow.
really, really super quick.
That's good.
But that rinse, instead of using the gunky chemical-based rinses that are on the shelf, finding a rinse that has actually good stuff for you is a good alternative.
Very good. Good to know.
Yeah, it's there are a lot of things out there that we've left behind because of advances in dental health, but also now we're bringing it back with the help of dentists that are taking more time to actually work with you and use old school techniques and are open. Like my surgeon, that's who recommended using homeopathics for healing. And I mean, I was like, oh gosh, okay, I will always go to that surgeon if I need dental surgery because they were so on top of it and just like everything's
Informative.
perfect.
And yes,
Yeah.
yes.
Yeah.
Wonderful.
Yeah.
That's wonderful.
Yeah. Well, let me know if you try the oil pulling. Have you tried
Okay.
it at all?
Well, no, other than just putting it on my gums and teeth. And it was very soothing somehow. You know, sometimes you can brush too hard or get some kind of discomfort while you're brushing. And it was really nice. So I just need to go back and do that again. It's been a while.
Yeah. Well, if you try it, let me know. They said
Okay.
that you're supposed to swish like 15, 20 minutes with the
Wow.
oil.
Okay.
Yeah. Which seems like a lot to me. But,
Right.
But it's supposed to take care of all sorts of stuff like gum health and bad breath. Like it's supposed to be really good for bad breath. Like
Okay.
if you have halitosis, you know, those people that have that, which sucks. But yeah, it's supposed to be really, really good for it, and kind of like help your mouth biome kind of balance out a little bit better.
Very good.
Yeah, I think we forget that our mouth has its own environment.
Yes, it does. Yes. Someone has called that something in particular, like its own.
It's a microbiome.
Okay.
Yeah.
Okay.
But because of that, we forget that that needs to be balanced. We need to take care of that. And I think that people get out of, they don't think about it. They're just thinking about brushing my teeth. Teeth health, like if you have infection here, it can cause all sorts of infections in your kidneys, in your liver, in your gut, in heart disease.
Heart disease, yes,
like
yes.
major heart disease. So this affects the whole body, which is why I love working with a dentist that understands that and takes all of that into consideration because it's really important.
It is. It really is.
All right.
It's been
Smiles,
interesting.
everyone. Smiles.
Yeah.
Big teeth.
Yeah, that's what we want. Or maybe not.
Or maybe not. Who knows? Anything else before we wrap it up?
No, I've enjoyed this. It's kind of reminded me of some things that, sometimes you stop using a product or whatever and kind of get away from it, and then you realize, oh yeah, that was a good idea. So
Yeah. I think we learn so much, and then we forget that we know these things.
yes,
And it's like, my gosh, if I'd have been doing this the whole time, then this,
right.
Yeah, it's crazy.
Like if I had been jumping rope ever since I was 6 years old, I would be totally different today.
Right?
You're not too young to start.
Oh, that's true. I gotta condition my knees a little bit better, but
Yeah.
All right. Well, hopefully this helps. Hopefully this helps in transitioning to taking better care of your mouth and finding a dentist that you really trust and will work with you on mouth health and your overall health.
Yes.
And
Very good.
Check that estrogen.
You. Yes, isn't that the truth?
Mm-hmm. All right. Well, until next time, ciao.
Ciao, baby.
Thanks for joining us. We hope to see you again next time for Things Mom Never Said, Secrets to Aging Well. We'll be back, so set your calendars, set your alarms, get ready, get set, follow, subscribe, and don't miss a beat.